Talk. Hey everyone, Dr. Dustin Portela here, board certified dermatologist, and today we're diving into one of the most oddly satisfying yet dangerously misunderstood topics in skincare. Talk. Blackhead extractions. You've probably seen countless videos where people press, poke, or squeeze away at their pores. But here's the thing, most of them are doing it completely wrong. Now don't get me wrong, I get the temptation. That little black dot on your nose looks like it's begging to be popped, but one wrong move and you're dealing with redness, irritation, and even scarring that lasts way longer than the blackhead ever would. So today we're not just reacting to some extraction clips, we're breaking down exactly what's safe, what's not, and how dermatologists actually perform extractions the right way. We'll talk about the tools, the technique, and the hygiene that make all the difference. Clean instruments, gentle pressure, and yes, even proper lighting. You'd be amazed how many at-home extractions go sideways just because someone used their bathroom mirror and a pair of tweezers they found in a drawer. And hey, before we jump in, be honest for a second. Have you ever tried popping a blackhead yourself? Tell me in the comments! No judgment here, I promise! We've all done it at least once. By the end of this video, you'll know how to tell when an extraction is safe to do at home and when it's time to let a professional handle it. Because clear skin is great, but healthy skin is even better. Alright, so in this clip we're watching someone go after a cluster of blackheads on the nose, and at first glance, it looks like those little dark dots are just dirt trapped under the skin. But here's the twist that surprises most people: that's not dirt, it's chemistry! What you're actually seeing are tiny plugs made of oiled dead skin cells and bacteria that have oxidized at the surface. Think of them as miniature corks sealing off the top of a pore. When oxygen in the air reacts with the material inside, it darkens, the same way an apple turns brown after you slice it. That's oxidation in action. Now, let's break down what's really happening beneath the surface. Each pore on your skin contains a sebaceous gland whose main job is to produce sebum, a natural oil that keeps your skin soft and hydrated. Ideally, that oil flows smoothly to the surface and does its job protecting your skin barrier. But sometimes that balance gets thrown off. Maybe you've got a bit too much sebum, or your skin isn't shedding dead cells efficiently, or you've been using a product that clogs pores. When all that buildup mixes together, it creates a plug inside the follicle, and that's the start of a blackhead. What's interesting is that blackheads aren't always a sign of dirty skin. In fact, you can wash your face religiously and still get them. Some people simply have oilier skin types or produce thicker sebum that doesn't flow as easily. Hormonal fluctuations also play a big role, especially during teenage years, pregnancy, or even stressful weeks when your cortisol levels go up. Your oil glands respond to those internal changes, and before you know it, your pores start looking like tiny traffic jams. Watching this clip, you can actually see that when the extractor tool is used correctly, gentle pressure, perpendicular angle, and clean technique, that plug pops out in one smooth motion. It's oddly satisfying because it's literally clearing a micro blockage. But if you push too hard, dig at the skin, or use unclean tools, you risk rupturing the pore wall. That can lead to inflammation, redness, and sometimes even scarring. So while the extraction itself looks quick, what you're really witnessing is a delicate balance between clearing the blockage and keeping the skin barrier intact. Now, let's talk about why some people seem to get blackheads no matter what they do. A lot of it comes down to genetics and skin behavior. If your pores are naturally larger, they tend to collect debris more easily. If your sebum composition contains more waxy components, it's more likely to solidify and form plugs. Even the environment plays a part. Humid climates can make oil production spike, while dry conditions can cause overcompensation from your glands. So it's a team effort between biology, environment, and skincare habits. Here's where chemistry gets fascinating. That dark tip of the blackhead isn't a cap of dirt, it's melanin and sebum that have been oxidized. So when you see those satisfying extractions online, you're actually watching a small chemistry experiment play out on someone's skin. The gunk being removed is a mix of lipid material and dead keratin, the same protein that makes up your hair and nails. When exposed to air, it oxidizes and darkens. So in a sense, your pores are having their own little science fair. Now, if you're wondering how to prevent blackheads without turning your bathroom into an extraction clinic, the secret lies in prevention, not pressure. Gentle exfoliation is your best friend here. Products containing AHAs like glycolic acid or BHAs like salicylic acid help dissolve that sticky buildup inside the pore before it hardens into a plug. BHAs in particular are oil soluble, meaning they can travel into the pore lining and clear out excess sebum from the inside. It's like sending in a tiny cleaning crew that works invisibly. Talk without the redness or irritation that comes from picking or squeezing. Another underrated tip, hydration. When the skin is dry, it signals your oil glands to produce more sebum, making the problem worse. So balancing hydration with lightweight, non-comedogenic moisturizers helps keep oil flow steady and reduces congestion over time. So as you're watching this extraction clip, remember blackheads aren't the enemy, and they definitely aren't caused by dirt. They're just your skin doing its natural thing, sometimes a little too enthusiastically. The real goal isn't to attack them, but to manage them with smart skincare habits and consistency. Did you know blackheads weren't caused by dirt before watching? Let me know in the comments. I'm curious how many myths we just cleared up today. Okay, so right off the bat in this clip, we see someone jump straight into extractions, no cleanser, no prep, just pressing away at their skin, and I have to admit my dermatologist instincts kick in immediately. It's like watching someone cook without washing their hands first. Sure, they might still get a meal, but there's a high chance of contamination, irritation, or in this case, unnecessary redness and inflammation. Here's the thing, good extractions aren't about brute force, they're about preparation. The secret to a smooth, clean extraction actually starts before you even touch your skin. Most people skip this step, but it's the difference between a satisfying, safe extraction and a mini skin disaster. Let's start with the concept of softening the skin. Your pores don't actually open and close like doors. That's a bit of a skincare myth, but they can relax when exposed to warmth and moisture. Think of your skin like a piece of leather. When it's dry and stiff, it's harder to manipulate. When it's warmed up, it becomes flexible and easier to work with. That's what a warm compress or gentle facial steam does. It helps soften the keratin, plug the actual blackhead, loosens trapped sebum, and allows extractions to happen with less pressure and trauma. When dermatologists or estheticians prep the skin, they usually start with a thorough cleanse using a gentle, pH-balanced cleanser. Something like a mild foaming or gel cleanser with salicylic acid can help remove surface oil and bacteria while beginning to clear the pores chemically. That's step one. Clean slate. Clean hands, clean tools. You'd be amazed how many at-home extractions go wrong simply because bacteria were already present before the first squeeze. Then comes the magic of steam or a warm compress. Now, you don't need a professional facial steamer. A bowl of warm water and a towel work just fine. Hold the warm, not hot, towel over your face for a few minutes. This helps soften the top layer of skin and makes the blackhead plug more pliable. You're essentially telling your pores, hey, relax, we're doing this gently. It also increases blood circulation, which helps your skin heal faster post-extraction. Sometimes, professionals also use mild exfoliation before extraction, and that's another step people tend to skip. A light exfoliant containing alpha-hydroxy acids, like glycolic or lactic acid or beta-hydroxy acids, like salicylic acid, can loosen dead cells that might be trapping oil in the pores. It's like unclogging the drain before you try to snake it. When you exfoliate gently, your extractions become more effective and less aggressive because the buildup is already halfway cleared. In this clip, though, you can see the opposite. The person's skin looks tight and a bit dry, which means that when pressure is applied, the skin resists. Instead of the blackhead gliding out cleanly, the surrounding tissue gets irritated. It's not only less effective, it can also lead to broken capillaries, redness, or even small scabs. So while the video looks satisfying for a few seconds, the after effects can take days to calm down. Another key part of prep that people forget, disinfection. Before you even begin, make sure your extractor tool or cum-dome loop is clean. A quick wipe with rubbing alcohol goes a long way, and your hands always washed thoroughly. Our fingers are covered in bacteria. And pressing them into open pores is basically sending an invitation to inflammation. Professionals wear gloves for a reason. If you're doing this at home, you don't need a full clinic setup. Just clean hands, sanitized tools, and a gentle cleanser that supports skin health. Look for something dermatologist-approved like CeraVe's Renewing Essay Cleanser or La Roche-Posay's Effaclar line, which help maintain the barrier while keeping the pores clear. And don't skip hydration after prepping. A lightweight moisturizer helps the skin recover from the warmth and ensures it doesn't get stripped or tight before extractions start. One pro tip I always share with my patients, never use scalding steam. It doesn't open your pores faster, it just irritates your skin barrier. If it's too hot for your hand, it's too hot for your face. You want warmth, not a sauna session. Watching this clip, it's easy to understand why prep feels like an optional step. the results can still look dramatic even without it. But what you don't see is how the skin reacts hours later. Proper preparation minimizes that risk entirely. It's the calm before the eye extraction storm, and it's what keeps your skin smooth, not scarred. So next time you're tempted to jump straight into squeezing, remember that your skin will thank you for taking those extra few minutes to prep. Warmth, gentle exfoliation, and cleanliness might not go viral, but they're what separate safe extractions from skin emergencies. What's your favorite way to prep your skin? Steam, cleanser, or mask? I'd love to hear how you get your skin ready before extraction day. Alright, so in this clip, we're finally watching something that makes my dermatologist heart happy. A proper, careful blackhead extraction done the right way. You can tell right away this person knows what they're doing. The skin looks prepped, slightly softened, and clean. That's a great start because half of a successful extraction is what happens before the first squeeze. Now, watch closely as the professional positions the extractor tool. Notice how they're not digging, scraping, or pushing straight down like a jackhammer. Instead, they're applying gentle, even pressure around the blackhead, not A's on top of it. That's key. The idea isn't to force the blackhead out, it's to gently coax it upward. Think of it like easing a cork out of a bottle, not trying to pop a zit out of existence. When using a come-down extractor, the loop should rest around the blackhead, not over healthy skin. A little tilt of the hand, a steady angle, and light. Even pressure from both sides help lift the plug out naturally. If it doesn't come out easily within 1 or 2 tries, that's your cue to stop. It's not ready yet, and forcing it will only inflame the pore or even tear the skin. And remember, if you're leaving dents, you're doing it wrong! Some professionals prefer using cotton swabs instead of metal tools, especially on sensitive skin or areas like the nose or cheeks. It's a softer, safer way to apply controlled pressure. You'd use 2 clean swabs, pressing gently on opposite sides of the blackhead to roll it out instead of pinching. The goal is never to crush or dig into the skin. You're simply guiding what's already loosened to the surface. Now, as you're watching this extraction, pay attention to how methodical it is. They're working slowly, pore by pore, wiping away each extraction with a clean pad or gauze soaked in antiseptic. That's not just for hygiene talk, it also gives the professional a clear view of what's been done so they don't overwork an area. Over-extraction, by the way, is one of the most common mistakes people make at home. It's easy to get carried away when you see results happening in real time, but pressing repeatedly in one spot can cause bruising, redness, or tiny scabs. I also love how they pause occasionally to assess the skin's response. You can see that after each extraction. There's a quick blot with a cotton pad to remove oil and debris. That keeps the area clean and prevents bacteria from sneaking into freshly cleared pores. Professionals might even dab a mild antiseptic solution or toner, something like witch hazel or a post-procedure mist to calm the area and reduce inflammation. Here's something most people don't realize. There's a sweet spot for pressure. Too light and nothing happens. Too heavy and you risk damaging the surrounding tissue. The right amount of pressure feels firm but not painful, like pressing down on a grape, not squashing it. If the skin starts turning red or looks angry, that's a sign to stop immediately. The goal is to extract what's ready, not force what's stuck. Let's talk a little about tools, because not all come-down extractors are created equal. A dermatologist-grade extractor is made of stainless steel and designed with precision, smooth edges, not sharp ones. Avoid the cheap ones that come in questionable kits online. Those can have rough edges that scrape your skin and introduce bacteria. Always sanitize before and after use with alcohol wipes. And if you're more comfortable with cotton swabs, that's perfectly fine. In fact, for beginners, they're safer. Now, as the clip continues, notice how the professional avoids sensitive areas like the under eye zone or near the lips. That skin is thinner and more delicate, and trying to extract there can lead to broken capillaries or hyperpigmentation. Focus on areas where blackheads naturally form: nose, chin, and forehead. A small but important step many people overlook is aftercare. Once extractions are complete, it's important to calm and protect the skin. A cool compress or a product containing niacinamide or aloe vera helps reduce redness and soothe irritation. And please, resist the urge to apply makeup right after. Your pores are temporarily more open and vulnerable. Give them at least a few hours to recover before applying anything occlusive. Now, humor me for a second. If you've ever finished an at-home extraction and found yourself with little circular marks or dents on your skin, congratulations. You've learned the hard way why gentleness matters. It's not about how much pressure you can apply, it's about how much control you have. A clean extraction shouldn't hurt or leave evidence behind. So, watching this video, you can see that with the right prep, clean tools, and proper technique, Extractions can be both satisfying and safe. It's precision over pressure every single time. Have you ever used an extractor tool before or just your fingers? Be honest. I'm curious which team you're on. Oh boy, this clip starts off rough. And by rough, I mean my dermatologist senses are screaming. You can already tell something's not right. No gloves, no cleanser in sight. And I'm pretty sure that extractor tool just came straight out of a bathroom drawer. It's like watching someone perform surgery with a butter knife. It might look harmless, but poor hygiene during extractions is one of the fastest ways to turn a simple clogged pore into a full-blown infection. Here's the thing: when you press on a blackhead, you're not just dealing with oil and dead skin, you're opening up a direct channel into your body's largest organ. That means bacteria, dirt, and even microscopic debris can slip inside. If your tools or hands aren't perfectly clean, that's basically rolling out the red carpet for inflammation, redness, and sometimes even pus-filled pimples that weren't there before. Not exactly the glowing skin you were going for. Now, I get it. A lot of these viral videos make extractions look so effortless and satisfying that it's easy to forget they're still a medical procedure. But professionals follow strict hygiene steps for a reason. Every tool that touches the skin is either sterilized in an autoclave or disinfected with medical-grade alcohol. Gloves aren't optional. They're the barrier between your skin and the microscopic world of bacteria that live on our hands. And don't even get me started on those who use bare fingers or, worse, long acrylic nails. You're not exfoliating, you're introducing an entire bacterial ecosystem. As I'm watching this video, I can see that the extractor tool isn't even wiped between extractions. That's like reusing the same tissue on 10 different pores. Each pore has its own mix of oil, dead skin, and bacteria. So when you go from one spot to another without cleaning, you're cross-contaminating. It's like hosting a bacteria potluck, and everyone's invited. Here's a simple pro hack that dermatologists swear by before you start: wipe the area with a 70% isopropyl alcohol pad or a gentle antiseptic toner. Then sanitize your extractor tool, even if it looks clean. Once you're done, wipe it again before putting it away. It takes less than a minute and saves your skin from potential breakouts or infections. And please never ever rest your tool or fingers on a countertop or your phone while extracting. Your phone screen shouldn't be cleaner than your tools. And trust me, your phone are not clean. It's one of the dirtiest surfaces you touch all day. That's why in a dermatologist's office, everything from the gloves to the cotton pads is either disposable or sanitized after every use. In this clip, the person also keeps touching their face between extractions, and you can see the skin starting to redden and swell. That's inflammation setting in. And it can easily turn into post-inflammatory hyperpigmentation, those dark marks that stick around long after the breakout is gone. A single careless move can leave you dealing with months of uneven tone. Professionals handle this differently. At a dermatology clinic, we start every extraction session with clean gloves, sterilized tools, and disinfected surfaces. Between each pore, the area is blotted and cleaned again. It's not just for precision, it's for protection. When you maintain that level of hygiene, you're ensuring the skin stays calm and that no secondary breakouts occur afterward. Here's another tip that's often overlooked. Replace or clean your extractor tools regularly. Stainless steel doesn't mean bacteria-proof. Wash them with soap and warm water, then disinfect with rubbing alcohol before and after every session. If you're using cotton swabs instead of tools, use a new pair for each extraction, one and done. And always wash your hands with antibacterial soap for at least 20 seconds before starting. A lot of my patients ask, but Dr. Dustin, what if I just disinfect with wipes after? Sure, that's better than nothing, but remember, the goal is not to minimize damage after the fact, it's to prevent it. Prevention is the quiet hero of skincare. The fewer bacteria you introduce during the process, the better your healing and overall results will be. Also, if you notice swelling, throbbing pain, or yellow crusting after a DIY session, that's your skin waving a big red flag that something got infected. That's when you should absolutely see a dermatologist. We can treat it with proper topical antibiotics or anti-inflammatory treatments and help prevent scarring before it becomes permanent. Now let's talk product hygiene too. If you're using post-extraction serums or calming gels, make sure you're not dipping dirty fingers into a jar. Use a clean spatula or pump dispenser to keep bacteria out. Brands like La Roche, Posay, and CeraVe make some excellent calming gels that are packaged to stay sanitary. It's one of those small details that make a big difference in keeping your skin safe. So as you watch this video, it's a perfect reminder that skincare is equal parts science and sanitation. The most satisfying extraction in the world isn't worth it if you're trading clear pores for a week of inflammation. Clean tools, clean hands, clean habits, that's the real glow up secret. Would you trust someone else to extract your blackheads, or do you prefer DIY? Talk. I'm genuinely curious how many of you brave the battlefield of pores on your own. So in this clip, we're seeing what happens right after a round of extractions. And honestly, talk. This is something I see way too often. The skin looks red, shiny, and irritated, especially around the nose and cheeks. That angry flush isn't unusual. Talk. It's your skin's natural inflammatory response. When you apply pressure during extractions, even gentle ones, the tiny blood vessels in the area expand, and the skin barrier becomes more vulnerable. It's basically your skin saying, hey, talk, that was a bit much, can we chill for a second? What happens next is where a lot of people either help their skin heal beautifully or accidentally make things worse. Unfortunately, talk, in this video the person goes straight from squeezing to wiping with what looks like an alcohol pad, and oof, I could feel that sting through the screen. TikTok, alcohol-based products might seem like they're disinfecting, but really, they strip away moisture and damage the protective lipid layer your skin needs to heal. Talk. It's like disinfecting a paper cut with lemon juice. Sure, it's clean, but you'll regret it. Instead, what your skin needs after extractions is calm, comfort, talk, and hydration. When the pores are freshly cleared, they're wide open and sensitive. Talk, the barrier, that invisible layer that keeps good things in and bad things out, is temporarily weakened. That's why the golden rule of post-extraction care is to focus on barrier repair and anti-inflammatory ingredients. The first step should always be to cleanse gently with a mild, non-foaming cleanser to remove any residual debris or antiseptic without over-drying. Something fragrance-free and dermatologist tested, like a creamy cleanser from CeraVe or Vanacream, works perfectly. You're not trying to deep clean at this stage. Talk, you're just creating a calm environment so your skin can recover. Next comes cooling and soothing. In the clinic, talk, I'll often apply a cold compress or a cooling gel mask for a few minutes right after extractions. This helps constrict those dilated capillaries and reduces the flush. At home, talk, you can use a clean, damp washcloth that's been chilled in the fridge, not the freezer, for a gentle cooling effect. Then, follow up with calming ingredients like aloe vera, niacinamide, talk, panthenol, or green tea extract. Niacinamide is a superstar here. It reduces redness, strengthens the skin barrier, and even helps prevent post-inflammatory hyperpigmentation, those stubborn dark marks that sometimes show up after irritation. Now, let's address the biggest myth I still hear all the time. Talk, you should dry out your skin after extractions to prevent breakouts. Das up, please don't. Dry skin equals a confused skin barrier, which leads to overproduction of oil and more clogged pores later. The right move is to moisturize even if you're acne prone. Go for lightweight, talk, non-comedogenic formulas. Think Jill moisturizers with ingredients like ceramides and hyaluronic acid. These help lock in hydration without clogging your freshly cleared pores. Talk. Another myth that refuses to dye toothpaste on breakouts. Please just know, toothpaste belongs on your toothbrush, not your skin. It contains ingredients like menthol and hydrogen peroxide that are far too harsh and can cause chemical burns or hyperpigmentation. Talk, same goes for rubbing alcohol or straight witch hazel. They might feel refreshing, but they actually inflame and dehydrate the skin. Post-extraction care should feel soothing, not stingy. Now, if your skin is feeling especially tender, adding a thin layer of a barrier repair cream can make a big difference. Products containing ceramides, squalane, talk, or madecassoside from Centella asiatica help your skin rebuild that lipid layer that was disrupted during extractions. It's like putting a soft protective blanket back over your skin. Talk, and don't forget the last step, sunscreen. I know it's tempting to skip SPF, especially when your skin feels sensitive, but UV exposure on freshly treated skin can cause pigmentation and delay healing. Choose a mineral-based sunscreen with zinc oxide or titanium dioxide. Talk, those are less irritating and actually help calm inflammation. As I'm watching this video, talk, I can't help but wish the person had ended their routine with just a little bit of patience and the right aftercare. The redness you see could easily have been minimized with a few simple steps: cool, soothe, hydrate, protect. No fancy ingredients, no 10-step routines, just barrier love and consistency. TikTok, and if you really want to level up your recovery, consider using a calming sheet mask that's fragrance-free and alcohol-free about an hour later. It's not just relaxing. It helps replenish moisture and keeps irritation from turning into peeling or sensitivity. So to recap the professional mindset, talk. Extraction isn't the end of the skincare process, it's the middle. What you do right after determines how your skin looks days later. Redness is normal, but it shouldn't linger. Talk. If it does, it's a sign the barrier is struggling, and that's your cue to bring in soothing, hydrating reinforcements, not harsh toners or drying treatments. Tuck in a little humor to finish the point. If your skin feels like it's holding a grudge after extractions, it's time to apologize with aloe, not alcohol. Talk, what's your go-to product for calming your skin after breakouts? I'm curious if you're Team Soothing Gel, Team Barrier Cream, or Team Help. I just learned toothpaste was a bad idea. Watching this before and after clip, you can really see the transformation. The skin goes from dull, congested, talk, and bumpy to smoother and more refined. It's the kind of progress that doesn't come from one dramatic extraction session, but from steady, consistent care over time. Talk. And that's the real secret right there. Blackhead prevention isn't about quick fixes. It's about long-term habits that keep your pores happy, balanced, and unclogged. The most common mistake I see people make is treating blackheads like a one-time problem instead of an ongoing part of skin maintenance. Your skin produces oil every day, sheds cells every day, and gets exposed to dirt and pollution every day, so it needs a routine that manages all that gently and regularly. Over-cleansing or scrubbing like you're sanding a piece of wood doesn't make blackheads go away faster. It actually irritates the skin and signals your oil glands to produce more sebum. The goal isn't to strip your skin, it's to support it. Let's start with the basics. Cleansing. Twice a day is enough, once in the morning and once before bed. Use a gentle, pH balanced cleanser that removes excess oil and impurities without drying the skin. Look for ingredients like salicylic acid or zinc if you're prone to blackheads. Salicylic acid, beta-hydroxy acid BI, is oil-soluble, meaning it can penetrate into pores and break down that mix of sebum and dead skin that leads to blackheads. It's like having a tiny, invisible vacuum cleaner working beneath the surface, but without the trauma of squeezing. Next, exfoliation. This is where a lot of people overdo it. You don't need harsh scrubs with beads or gritty particles. Those can cause micro tears in your skin and make inflammation worse. Instead, go for gentle chemical exfoliation 2 or 3 times a week. A is like glycolic acid work on the surface to remove dead cells, while BAs like salicylic acid work deeper inside the pore. Used consistently, they help prevent buildup before it even starts. It's less about attacking blackheads and more about keeping the environment of your skin balanced and breathable. Hydration might sound counterintuitive if you have oily or blackhead-prone skin, but it's one of the biggest game changers. When your skin is dehydrated, it compensates by producing more oil, and more oil means more potential for clogged pores. A lightweight oil-free moisturizer helps restore balance and keeps your barrier strong. Ingredients like ceramides, hyaluronic acid, and glycerin are ideal. They hydrate without suffocating your pores. Think of it as giving your skin a smooth, healthy surface so it doesn't panic and overproduce oil. One of my favorite long-term prevention tools is a retinoid. Retinoids are like adapalene or prescription tretinoin, increase cell turnover and keep pores clear by helping your skin shed dead cells efficiently. They're like the ultimate maintenance crew, constantly renewing the top layer of your skin. They also smooth out texture and help fade marks from past breakouts. Start slow, a few nights a week, and always use sunscreen during the day, since retinoids can make your skin more sensitive to UV light. Speaking of sunscreen, please don't skip it. UV damage doesn't just age your skin, it thickens the top layer, which can trap more debris in your pores over time. Go for a non-comedogenic, oil-free SPF 30 or higher. It protects your barrier and keeps inflammation and pigmentation under control. If you've ever noticed your blackhead-prone areas looking darker or rougher after sun exposure, that's why. SPF is truly one of the best anti-blackhead steps out there, even if it doesn't sound as glamorous. Now, weekly habits matter too. Once a week, try a gentle clay mask with kaolin or bentonite. These ingredients help absorb excess oil and impurities without stripping moisture. It's a great reset for congested areas like the nose or chin. Follow up with a soothing moisturizer afterward. You want to draw out the oil, not the life out of your skin. In this before and after clip, what really stands out isn't perfection, it's progress. The skin looks calmer, more balanced, and overall healthier, and that's what dermatologists love to see. Clear skin isn't about having 0 pores or never getting a single blackhead again. It's about creating a steady rhythm of care so your skin stays resilient, not reactive. Consistency is what wins. Even the best products won't help if they're used sporadically. And even simple routines work wonders when you stick with them. So if you're watching this and feeling like your blackheads just won't quit, remember patience beats pressure every time. You're not trying to punish your skin, you're trying to partner with it. And maybe the most important mindset shift, prevention is a lifestyle, not a punishment. You don't have to exfoliate every night, you don't have to spend hundreds on products, and you definitely don't have to scrub until you're red. Balance, hydration, gentle exfoliation, and daily protection. That's the real long-term formula. Clear skin isn't about perfection, it's about patience and prevention. Would you like a full dermatologist daily routine video next? Drop a yes in the comments. I'd love to walk you through exactly how to build one step by step.